take you here now. South Africa's chairperson for the Portfolio Committee of Health, Dr. Kenneth Jacobs, will this week provide TB advocates and with an update on Parliament's approach to dealing with the country's burgeoning TB epidemic. Dr. Jacobs' address will officially open the inaugural convening of the TB Accountability Consortium, which takes place in Rosebank. Now, let's discuss this further. We're now joined by teams by Sihle Mahonga Ndawonde, is the project officer for the TB Accountability Consortium, an initiative of the Rural Health Advocacy Project. Thank you so much for your time this afternoon. So we know that world leaders, at the United Nations General Assembly's high-level meeting on TB have approved a political declaration. It has very ambitious targets for the next 5 years or so, to end TB. How feasible are these targets, would you say? Just taking into account that not too long ago, we heard that only 34 million people of the intended 40 million people with TB were reached with treatment between 2018 and 2022?
I think, obviously, I also agree with you. They are very ambitious goals. We know that within 2018, we had the UN high-level meeting on TB, which is the first high-level meeting of its kind. And I think 4 to 5 years from that, we are still saying that yes, these declarations were made, but the actions that were made from that declaration to the one that happened a few weeks ago in September, these things are still ones that have not been realized. We still are needing action in terms of the goals that were made from the 2018 one versus the one that has been made now. So how I see it and how our consortium is seeing it is that we are done with declarations, but we really are wanting concrete and actionable action within our governments and also within the global commitments that have already been made.
Just for the benefit of our viewers, if we can just take a step back and maybe just touch on one or two of those declarations that have been made, and just your thoughts on how at least the gap that has not been reached will be reached in as far as people that need that pertinent treatment.
Yes, so in the 2018 high-level declaration on TB, there was around 4 billion rand that was meant to, $4 billion that was meant to be put together in terms of the, the SA commitments towards TB. So that was for that time. And so then now they've obviously added, more money within, those declarations. And so for our consortium, it's in understanding that, okay, so we had X amount of money that was put towards research and development for tuberculosis in 2018, but now we're needing further understanding of those targets were not met. And so now there is around $7 billion that has been put towards that. And so we're needing some clarity as to how that is going to happen when we're coming into our national and local and district level, these implementations of those declarations. So on our end, when it comes to these global declarations, it's obviously a United Nations initiative. And so this General Assembly was one where there's been a lot of talk in terms of there being a need for these commitments. I mean, with South Africa, we account for around 3% of the global TB burden. So I think it's a really big deal that we actually have some sort of concrete idea as to how these things are going to be implemented when it comes to national implementation.
When you look at the numbers, they're quite staggering. TB today kills over 1 million people, and over 10 million people fall sick due to the disease, a disease that could be prevented. It is curable. I mean, how do we then strengthen the link, I would imagine, between people diagnosed with TB and the treatment thereof?
Yes, I mean, as you're saying, those who are undiagnosed or those that haven't been tested for TB are one of the major keys in which we are still having to grapple with this epidemic in our country. Obviously, we're still dealing also with a quote unquote post-pandemic result of there being services that were being serviced for TB. But obviously within the COVID pandemic, a lot of the wins that we had as a country, sadly fell away. And so we're needing some sort of a coordinated effort that needs to happen where national, district and local level implementation is all coordinated in a cohesive way. We know that we had, within the COVID pandemic, there was around 54 to 56,000 deaths, and we had around 300,000 new cases, of which around 170 were unaccounted for. So you can understand where you're dealing with undiagnosed people that we are needing to deal with that the most. And so, I would be appealing for government to really give, heed to those who are giving data governance for, decision making within our country, and also for us as advocates to be part of that conversation. And I think that's kind of ultimately what we're wanting this consortium convening to be about, is that there is that bidirectional understanding and communication between, civil society and those who have also decision making powers.
Sihle, the World Health Organization launched the TB Vaccine Accelerator Council. Just talk to us about your thoughts around that, if it's in the vaccination sector, and maybe perhaps talk to us a little bit about the TB Accountability Consortium and efforts that you are making towards that.
Yes, I mean, when it comes to vaccines, obviously there have been some really exciting ones that have been coming into the pipeline. And actually, as Africa, we are very blessed to actually have 2 of those clinical trials that are being rolled out. And so those are really wonderful in terms of seeing it as a means of widening the means of people who are exposed to TB to actually not get the TB bacteria. So for me, that's ultimately, a great stride towards a means of people who have TB to be on treatment, and those who are exposed to it to also be, vaccinated for it. So when it comes to the TB Accountability Consortium, we are a growing consortium that is ultimately wanting for the means and the agenda for tuberculosis to be elevated within the country. As I previously had said, SA accounts for around 3% of the global TB burden. And I think it's incredibly important for us as a country that we're dealing with a disease that mainly affects the poor. And ultimately, if we are wanting to have a health system that benefits all, we're needing to, obviously deal with such diseases that actually affects a lot of the people that are in socioeconomic predicaments within our country. So ultimately, that's what this consortium is meant to be. It is a collaborative coalition of advocates, civil society advocates, as well as those within research and development as well.
Sihle, thank you so much for your time. Of course, that's where we have to leave it for now. Of course, that was Sihle Mahonga Ndawonde, is the project officer for the TB Accountability Consortium.